The Quality Management System Regulation, or QMSR, is about to go into effect next February, and the clock is ticking. That is why we are kicking off a brand new content series on Let's Talk Risk. It's called the 90-Day Action Plan for QMSR Readiness. As part of this series, we will be preparing a lot of different podcast conversations, like today's conversation. And for that, I'm really excited to welcome my guest, Megan Kane, today to this very special episode of the Let's Talk Risk podcast. Now, Megan is someone I have really admired for a long time because she has such a broad experience. And she just started her own consulting practice. We're going to talk about that a little bit in this conversation today. But Megan has seen a broad range of products, company settings, and environments. And because of that, I think she is in a great position to help us decode a little bit about what the new world of QMSR might look like. Now, this is not about templates or procedures or gap assessments. This is more about how FDA would expect us to do the business of quality in our organizations. So I can't wait to have this conversation with Megan. And with that, Megan, thanks for coming to the show again. How are you today?
Thank you. I'm so glad to be here.
Now, Megan, as I noted in my remarks, that you have seen a very broad range of environments and products. You have experience with AI-enabled software as a medical device. You have seen IVDs. You have seen implantables. You have worked with big corporations. You have worked with contract manufacturers and also startup organizations. So, in this conversation today, Megan, I want to really focus on what the environment might be like, you think, in a small company or a startup organization as they prepare for the new world of QMSR. So let's set the stage. First of all, what is it like to work in a startup or a small organization?
Yeah, there's nothing quite like the feeling of working in a small medtech startup. I think the energy and the agency that you have there is just a really unique experience. And I think the way that you have the ability to make improvements very quickly is what makes a startup successful. You're able to iterate, you're able to try new things. And that can be really rewarding for a lot of people who don't mind a bit of chaos in the midst of that. But the downside that comes with that is that things are moving so quickly, and there's a lot that every single role has to juggle at all times. So when something comes along, like a change in regulatory frameworks, that can feel overwhelming to startups, especially if they don't have an in-house quality or regulatory role. That now becomes an extra burden for them, where they thought they understood the regulations they needed to meet and how they were going to approach that. And now there's this big shift. Does that mean that they need to hire new staff to address it? Do they need to start over the regulatory strategy? It just becomes an extra pain point for them when they already have so much going on.
Yeah, there is a sense of energy and a can-do attitude in these organizations. And sure, we don't know a whole lot of things. The upside is there aren't too many boring meetings, right? There aren't too many like bureaucratic stuff, but let's go get it done. At the same time, let's also figure out while we are doing it. So it's a dual challenge, but I have a feeling that the personality of people in those organizations is like a can do it. We can do it. Like we can work on it, can do it. And it must be very refreshing.
It is, and it's very fun again for people in our role, because oftentimes when you're working on a quality department or regulatory department in a larger organization, I find that other departments are less willing to learn about what it is that you do and why your work matters. They sort of hope to outsource it to your team and not have to think about it too much. But in a smaller company like a startup, I find the leaders are much more interested. They want to be really hands-on, want to co-develop that quality management system with you. So it feels way more collaborative in those types of environments.
So, Megan, as you look back on your experience in these environments, what do you think might be happening right now as leaders and colleagues in these companies start to prepare for the QMSR transition? What might be going on right now?
I think certainly we've seen a lot of discussion around this amongst the quality and regulatory field. I think people are starting to post content about it and share the warnings that it's coming really soon. And hopefully startups or any size company that sort of has the pulse on that regulatory information, they're able to make those changes early. So hopefully those companies are well underway already with making that transition. But inevitably, whenever there's a regulatory change like this, There are always companies who wait until right up until the deadline, or even sometimes past the deadline, to start to implement those changes. So for those companies where we're getting close to the wire now, I think that's when they start to really have to get their plan in place, especially as we're in, near the end of Q4, we're starting to think about plans for 2026. Hopefully those companies are considering the QMSR transition as well.
Now, on paper, I know I have read this, and FDA has made a statement that it's really should not be a big deal. Their expectations from the quality management system under the QSR are basically no different than what they would expect under the QMSR. But here's a subtle difference. The QSR, I think, is written almost like a checklist. From start to finish, it seems like a checklist. Whereas QMSR is, we know, based on ISO 13485, which is a process-oriented quality management system. It has a lot of moving parts which are connected to each other. And the whole notion of risk management is across the board. It's the thread that binds everything together. I'm curious to hear your perspective on how you think people would really think about this type of an approach to the quality management system. Would there be any sort of challenges that they might face in the near term? And whether it's a small company or large company doesn't matter. But I would ask you to reflect on what might be most challenging for people as they move from a sort of a checklist compliance oriented approach to a process based approach under 13485.
Definitely. I see this a lot with companies who are used to that legacy system with FDA, and they tend to think about that old QSR compliance as more of a downstream effort, so something way later in the process. So they might start to look at that checklist, like you said, right when they're about to do their submission, or when there's maybe an FDA inspection ahead. And that's much later when I believe, and I think a lot of quality and regulatory folks believe, that you should be thinking about compliance. So this new framework where we're leaning more into ISO 13485 and the process method, that forces you to have a much further upstream type of approach. Because very early on in development and early on in building out your company, you need to be thinking about the processes that govern the way you do everything within your company. And that mindset is much more in line with 13485. I think now FDA is saying to us that's the mindset that they want to see companies take. So I do think that this transition was really a signal from them that they want companies to reimagine how they're developing their processes.
And I guess it'll matter when you go to FDA with, let's say, a new 510K or a de novo or a PMA application, and they might want to ask you about how you have done this and how you plan to sustain this. And I know FDA right now is in a lot of chaos. Like we know everything, like everything else, there's a lot of chaos going on. But when the dust settles, I have a feeling that there might be a little bit of a closer inspection or review of your quality management system, even in the pre-market phase. Does that sound like a reasonable assumption to you? Do you think that might happen in the future?
Yes, absolutely. And from what I've seen, yes, we know everything is a bit of chaos right now at the FDA level, especially at the leadership level. But all of the reviewers that I know personally, regardless of what is happening with the organization as a whole, when they're sitting down to do their review, they are doing a thorough job. They are doing it to the best of their ability always. So regardless of what's happening at a larger scale, when you actually put your submission in for review, you should expect to have that sort of detailed assessment that's done. And if at the time that you go for submission, the QMSR is now valid, then you do need to make sure that you're following that approach. I don't think people can, sneak in any kind of gaps with the hopes that because there's chaos, it won't be noticed.
Yeah, absolutely. And one area where I can think of where this scrutiny might be quite intense is how you have connected the outputs of your risk management to design inputs. This, in my mind, remains a big vulnerability for companies. And it's explicit in 13485 that you must connect the outputs of risk management with design inputs. And I've seen so many examples where this doesn't seem to be the case. And I don't know if it is consistent with your experience and how you feel companies might want to respond to it by strengthening their internal procedures. So, speak a little bit about what you have seen in terms of the integration of risk management with design controls and where you think there might be some particular challenges for companies.
Yes, and I was happy to see that in the preamble of QMSR, they do mention ISO 14971, because that has always been a gripe of mine. And I know that's something you and I share, that we're always trying to emphasize to companies how critical it is to consider risk management. And 14971 really is the gold standard for that. And when companies were only looking to the old QSR, that they were missing that key component. And so there often were issues. Now, by pointing to 1345 and then, by default also pointing to 14971, hopefully more companies will start to see that it's more than just an implicit expectation. It really is a mandatory requirement from day one.
So I guess it might translate into action in terms of how we have identified these hazards, hazardous situations, and harms and characteristics related to safety, risk analysis, and how we have used them to integrate that with our design inputs, and whether our design inputs are, as we say, complete and unambiguous, right? So the burden of proof could be much higher than what it is right now under the QSR because of this integration. Now, again, let's be honest, we don't exactly know how FDA is going to conduct their inspections because even the QSIT has not come out. But really, as I read the warning letters, and I've done so many of them, Megan, when I read these warning letters, the way FDA writes those observations speaks to me that they understand where the risk management is deficient, but they just cannot write explicitly against risk management. And even in QMSR world, 14971 is not a legally binding requirement. It's just a best practice. So let's talk about that a little bit more. How do you think FDA might actually reinforce that behavior and that expectation if you think it might lack the sort of legal authority to explicitly cite them? I mean, obviously 13485 has a lot of clauses where risk is explicit and they can cite them against those clauses, but it's not that clear how risk management output should be integrated with design input. It's not really clear. So let's talk about that a little bit. What is your perspective on that?
Yeah, I think that's honestly the case for many different types of clauses. For both 1345 and QMSR, a true regulatory and quality professional understands that when you're in an audit setting, there's more than just what is written on the page in some of those standards. There is an expectation and some industry standard processes that an auditor expects to see. And I think when you've been in this career long enough, you know to look out for that, right? So I'm trying to think of a good example of what that might be. Supplier audits, let's say, let's pick a category at random. There's nothing in any ISO that says how often you need to be auditing your critical suppliers, but we all sort of know as a profession that you should see some risk-based approach to auditing them more frequently based on their risk classification, right? That's a pretty standard process.
Mm-hmm.
And an auditor would be surprised to not see that there. So even though it doesn't say it explicitly, that is an expectation. I think risk is absolutely an even stronger case than that supplier example I gave, where FDA for a long time has been looking for exactly what you're describing. They want to see risk deeply embedded in your product development lifecycle, in your complaint management, in every step of your QMS processes. So I think if you're a company that's working with any kind of accomplished QA/RA professional, you should be able to mitigate those risks early on and have those baked into your processes.
So what I'm hearing you say is that the success will actually depend upon how capable our QA/RA professionals are. And as leaders in our organizations, we have to continue to invest in their capabilities and in their knowledge, skills. So this brings up the topic of competence, right? For a long time, we have talked only about training. And we know that competence is more than training. So I wonder what your thoughts are on that, because, you look at QSR and it just talks about training in a very narrow way, very, very narrow way. But now 13485 talks about competence in a much broader way across the board. And not only that, it asks you to evaluate competence and gaps in competence using a risk-based approach and effectiveness of your actions to build competence using a risk-based approach. So yeah, I would love to explore this topic with you also. What are your thoughts about treating this as a slightly more bigger topic from a leadership point of view? And not be just satisfied with like, hey, we trained our people, read and understood, check the box, here's a training record. I don't think that's going to fly. Do you agree with that?
Absolutely. Absolutely. I see that over and over again. It's so tempting to just want to do a read and understand kind of training. It would be very easy for all of us if that's all we had to do. But we all know deep down that that is not the most effective way to train any staff. I could read every SOP there is around product development, but that's not going to make me an engineer. There's no way I should be developing product, So it's not sufficient to just read a procedure and say that your staff is competent. There's much more that goes into it. And yes, it does take a little bit more time to try to ensure that with all of your employees, but I think there are ways that you can come up with efficient processes to manage that. It's worthwhile.
So, Megan, I think up until now, we have talked about a lot of topics in very general way, but let's talk about, again, come back to the small startup organization type of an environment. From your experience, where do you think would be their like top one or two challenges as they come to terms with this new world that we're going to live in of the QM?
Well, that's a great question. I think for a lot of startups, the challenge for them is to start to think about quality and regulatory as more of a global approach and think about their go-to-market as more of a global approach. I do see a lot of companies, and I think it's especially tempting with startups to really only focus on one market at a time. And that's understandable when you're just trying to get into those first few customer sites. It's easy to just think about where those customers are most convenient for you to find. But I think the shift to harmonizing QMSR with 13485 is that baby step in the right direction to a more global harmonization framework that we all in regulatory have been hoping for a long time. I know we're still a long way away from there, but I do think that it's a challenge that companies should start to take on now is how do we think about our go-to-market more globally? Like how do we think about harmonizing with international best practices like ISO standards, as opposed to these sort of checklist model that we're seeing with individual country regulations and processes?
So let's build on that. Now, again, in the startup environment or small company environment, of course, it has its own culture, it has its own rhythm and energy. It has a lot going for it, right? This environment has a lot of energy going into it. Where do you think they can tap into that energy and their passion for getting things done in order to think a little bit broadly? Now, of course, they're focused on the short term, but how can QA colleagues that we have in these companies or shape that type of a thinking, leveraging into this energy? Can you share any thoughts on that?
Yeah, absolutely. I think one thing that startups do really well is that they know that they don't have 100% of the skill sets in-house that they need in order to be successful. I mean, typically a startup began with 1 to 3 people usually. So they're very used to not having those resources. And in order for them to grow, they had to get really scrappy about where to find those experts. So whether that's seeking out advisors or accelerator programs or fractional roles or anybody that could help them in those early stages to answer their question. And I think when it comes to quality and regulatory, that's a perfect example of if you're a small company and you feel stuck in these QMSR transition or in any other regulatory question, and you aren't sure if your approach is the right one, it's well worth getting creative and using that startup energy to try to think about where you can find those experts to help you get unstuck.
So, what I'm hearing you is basically a nice tip for our colleagues in these companies is think creatively and think broadly, build a broad network and tap into that network and bring that knowledge in-house to pitch to your management and say, look, we really need this. This is the reason why we need this. We can't do it alone. And they would be more receptive to that message because they're used to borrowing expertise from outside. They just don't have everything. They just need to make a decision about where to focus first versus where to focus next. So the lesson I'm hearing you say is for our colleagues to really take that initiative and leverage that energy to go to the leadership and play a more leadership role, set the vision and help them achieve that vision. Did I get that right?
Yeah, and I think a lot of people in our field can find that it feels a little bit isolating because outside of the wonderful community that you built, there aren't a lot of places where people can really openly share the approaches that they've taken and the techniques that they're using to be successful in quality and regulatory. So you feel a little bit stuck in the bubble of your own company. And if you're at a startup or maybe you're the only QARA person, you don't have somebody to bounce ideas off of. So I love what you've built here with this, group of people who are, I believe, also willing to share. I know I can speak for myself that if anyone reached out to me just to want to talk through their ideas and get a second pair of eyes on something, I'm always so happy to do that. So I would encourage people to try to reach out even when maybe it feels a little bit uncomfortable to ask another QARA professional for their feedback.
Yeah, that's awesome. So, Megan, in the remaining time we have, I want to switch gears a little bit and ask you to reflect on your career journey, which has been really impressive and so diverse, and share with us maybe a backstory of what brought you to where you are today. With Relia, I believe, is the name of the consulting practice that you have launched, right? So, take us through your career journey and give us an insight about what got you here.
Yeah, sure. I think a lot of us in this field share a similar quality in that we sort of landed here by accident, right? We just our curiosity brought us here at some point or the other, and that was certainly the case for me. I've I've had such a breadth in my career and such a wide portfolio of products and company types because I'm always curious about how can I learn more and how can I jump into something new. You know, for example, I took a role at a software as a medical device company when I had absolutely no software experience whatsoever. I can barely get my own laptop to work properly, so I did not feel qualified, but I thought it was interesting and it seemed like a new area that I wanted to learn about. And so I took the role and learned a ton in that. And it ended up that software as a medical device is a favorite area for me. And it's my top area I like to work in regulatory because of that. So you never know where those jumps are going to lead you. And that's ultimately what led me to launching Relia, was because I found I still wanted to have that creative approach of how can I learn more? How can I jump into a project that I haven't tried before? And with consulting, I find that really fun because every new client, every new project is something different. Every QMS I build is looking completely different from ones that I've built in the past. So that for me allows me to be able to explore and keep on learning.
So obviously it took a lot of courage for you to jump into SAMD space and AI ML space. And I'm sure there were some challenges and struggles for you. Can you share maybe your early challenges and struggles in this field and how you overcame?
Yeah, I appreciate you saying that. I think it's just a nature of learning something new. So there are struggles that come along with that. It can be tempting to feel like you aren't qualified as an expert in AI because AI is so new for a lot of us. But I think what's great about regulatory is once you know how to interpret regulations and handle audits and write in the context that regulators want to see, you can sort of apply that to new regulatory frameworks as they're being released. So as new guidances are coming out for AI all the time and new regulations, then it's easier for you to become that expert by just taking a little bit of time to learn. So for me, a challenge is carving out that time to learn, right? That's always
Yeah,
the
sure.
tough one.
What I'm hearing you say is that being a regulatory professional also gives you a lot of translatable skills that you can apply in a totally new area if you have the courage to jump into that. So there's an opportunity here for all of us to kind of go beyond what we have done so far, feeling confident in our abilities. I mean, I am not a regulatory person, but I have a lot of admiration for people who do that because these regulatory documents are quite big, quite thick, and quite dense. And if you can understand that, wow, you have a lot of analytical abilities. And it should be translatable to other fields as well, whether it's software as a medical device or AI ML. Is that right? Or there are still some challenges in translating or adapting these skills to totally new fields?
No, I think you're right. And I find it funny that you say that you don't see yourself as a regulatory person because you're certainly an expert in 14971, among many other things. And it's really the same concept, right? You review that standard, you understand it as a framework, and what are they really asking for? How do you read between the lines here and apply that into something tangible within a company?
And I want to address something that you briefly mentioned, which actually is a big concern for all of us. We don't want to be seen as not knowing what we are talking about. This whole notion of imposter syndrome is real and everyone is affected by it. And I'll be the first one to admit that I face that challenge almost on a daily basis in my own life, in my own practice. And what I have come to learn is that in today's world, especially with AI going so fast, nobody can claim to be an expert in anything anymore. However, However, we can claim to have expertise, which is constantly growing. So, my perspective is that let's not focus on being seen as an expert, but let's focus on continuing to build our expertise every day so that people understand that, yeah, you are on this journey, never ending journey of improving your competence and expertise. I think that's a new world that we have to live in, right? So, how can Let's talk about that. How can leaders in organizations help their people overcome this mental barrier of imposter syndrome? Because I think that is, to me,
Yeah.
is the key to success.
Yeah, oh, absolutely. And I could not agree with you more. I think the concept of labeling anyone as an expert can be a bit dangerous. And I think it can lead to a lot of that feeling of imposter syndrome because when your title is expert, you feel like you need to uphold that expectation and that you aren't able to show any weakness or any gaps in your knowledge. But you're so right that it's very difficult for anyone to be a complete expert in hardly anything really. And
Yeah.
we all just have our own perspective, and everyone's perspective is made up of the culmination of their work experience and the learning that they've chosen to do. But everyone's perspective is entirely different, even if you're in the same exact field. So all I can do is provide insight based on my specific perspective, and there will be gaps in that that somebody else might be able to fill. And so if I think about myself as not offering an expert opinion, but rather just my perspective, then it allows me to also say there might be areas that I don't know, and I can share that freely and be truthful about that rather than trying to have to hide that and pretend like I know something that I don't know.
I personally see this as really the most important priority for leaders in MedTech today is to create a culture and environment where we are not looking for experts. We are looking for expertise and people who want to engage and people who want to learn and challenge the status quo and move the ball forward. We're not looking for experts who just want to shoot from the sidelines, right? So I hope that message resonates with people who are listening to this. Megan, we have talked about a lot of different things and we could continue to talk about this topic for a long time. But I want to close by just inviting you to share some top of mind key takeaway points that you might have for our colleagues to reflect on.
Yeah, I think we talked a lot about small startups. So whether you're at a small startup or a larger sized company, I think like any other regulatory change, QMSR is coming and we have to start to plan for it and think about it in a really strategic way. And so, I think some of the best takeaways we have from today's discussion are not considering yourself that expert and leaning on your network so that when we approach this QMSR change, can we do so by sharing ideas and tips with our fellow QARA colleagues? You mentioned your 90-day approach to the QMSR transition. I think that's wonderful. I'm excited to learn from that as well and share with the other people who are learning about it simultaneously. So I think that's the best takeaway is how can we go through this transition all together as a profession?
Wonderful, Megan. I would love to have you talk a little bit more about Relia and what your vision is, how people get in touch with you. We'll also post that information in the show notes, but share with us your vision and where you are going and how all of us can help you.
Absolutely. So Relia is specifically for digital health companies. So we help to incubate them as they grow and provide them all kinds of mentorship and resources that they need. And that includes things like regulatory and quality consulting and fractional leadership, as well as many other roles as well. But my role specifically is in the quality and regulatory side.
Wonderful. I wish you all the best. I'm really looking forward to hearing such great things that you will do and help your clients achieve the success in their field because I have known you for a little while and I've known your passion and your amazing insights. So I really wish you all the best. And thank you once again for coming to the show and sharing your insights.
Yes, thank you so much. It was wonderful.